care of Dr. Sam for a couple of weeks now. We're seeing some incredible results. We're drawing my blood. We're going to add my blood to Stephanie and Tony's samples, and we're going to see what shakes out. We're going to see how they mix up and what's revealed or what isn't. We're taking all the guesswork out of it, you know. So we should recap what we did last week.
Yes.
We had Stephanie here and Tony, two dear friends of mine. On camera, we drew samples of their blood. Then we drew mine, and we added it to their test tubes, right? So what we're looking at right now is the results of those two samples.
Correct.
With the interaction of mine.
Yes.
Okay.
So exactly. It's actually the first time we've opened it. So the results are in here as well. If you want to do the honors.
Sure. Okay, there's two Tonys, a Matlow, and a Sheen. Okay, cool. Yeah, these are all exactly what we had that night. Yeah.
Each of the results, you can see the person's individual name on the blood test. Now, we had added Charlie's blood to theirs. Now, if Charlie's blood was infected, it would have had a detectable, a positive detectable sign of the infection, which each of these blood tests we see is absolutely non-detectable. So this is an HIV-1 RNA test.
But this is glaring evidence that that we're onto something. This is some top shelf, next level shit, you know.
Then you're looking at healthy, normal cells, which would, it doesn't happen when you're on the cocktail for sure.
No,
it does not, and you feel like shit.
You do, but you're at zero.
Yeah, you're at zero, but you feel like
zero.
shit.
Yeah.
Because it's not a real zero. It's the virus is hiding. So if you look at it on a microscope, on an atom force microscope, you can see inside that the virus is still everywhere.
Sure.
Whereas with Dr. SAM CHACHOUA'S treatment, the virus is completely non-detectable in your blood, not in your cells, not hiding anywhere. Right. It is actually healed.
This defies any medical logic or any practical logic. This shouldn't happen based on everything that I've been told to date. Yeah, and keep in mind that these tests are done without me being on my cocktail of Norvir, Truvada, and Persistence.
And how did you feel on that?
I felt terrible. I felt terrible. I was taking poison every day and trying to function. And they say that's the best we can do. Well, I'm thinking this might be better than that.
He has no detectable virus in his blood. And would you say that you are HIV negative?
I would like to say that. Yeah, I mean, as we said, I'm HIV negative. And,
with blood tests.
With blood tests.
Stating your truth has the ability to affect the world in a pretty profound way.
Talk about checking a few boxes before you get teleported off this rock.
Exactly.
This is exciting. This might be what I was here to do this whole time. You know.
Well, in 1995, he had 30 vaccines tested, 99.9% effective in killing the AIDS virus. Cedars took his original cultures, which took 10 years and $10 million to make.
And this is after publishing his findings in their literature.
Correct.
Yeah.
And this was 1995, whereas, we're in 2015.
Right, yeah.
So we're talking about people who suppressed this technology for 20 years, and millions of lives have been, hundreds of thousands at least for sure, have been lost.
Yeah.
So.
And now I can say we all should have had access.
It wouldn't even be a disease today.
No, it would not.
It would be like polio at this point.
Yeah.
It would be something in the past, but because the technology was suppressed and people were not given access to it, we have been living with it in a way that we've been able to control the cocktail to give to people who say they're living healthy with this disease.
But if you come in and you're on the verge, you're on death's door, and your initial numbers are in the millions, and then over the course of a couple of months, you get down to zero with all the cocktail intervention. Shouldn't you then feel millions of times better than when you showed up.
Right.
You don't. You
And
don't.
you don't.
You don't. No.
Right.
You know. So it's pretty upside down.
Yeah.
And well, fuck it, we're here to kick down the door.